Okay. Hello, everybody. I'm Dr. Smrithi. I'm an OBG consultant, obstetrician and gynecologist, and an infertility consultant at Aster RV Hospital in JP Nagar, Bangalore. So, today we'll be talking about the first trimester in pregnancy, the fetal development during the first trimester, and the do's and don'ts. For every couple that has been trying pregnancy, they have a lot of questions even before they plan a pregnancy. And apart from that, once you actually conceive, there's a lot of things that go on in your mind, and you want to clarify those rather than believe the myths that you hear on the internet or from your friends and aunts and uncles. So this session is going to help in the understanding of the first trimester. So, to start off with, when does a pregnancy start? Right? So, you should understand that the menstrual cycle plays a very important role. Here, what happens is every period that a woman gets is a indicator that she is not conceived, right? But if she misses a period, then we immediately know that we need to check for a pregnancy. The way it starts is we check from the last menstrual period. The first day of the last menstrual period is taken as the first day in terms of the calculation of the gestational age. But it is 2 weeks prior to when the actual pregnancy would have got formed, right? So, in the first few weeks, the first 10 days to be more precise, the eggs start getting formed in the ovary. And these eggs are recruited, out of which only one forms a dominant follicle. This is the follicle which contains the egg, which leads to a pregnancy. Once the egg gets fertilized, which we cannot really precisely determine as to when it has got fertilized, that's from where it starts off, and that's from where it is getting continued as a pregnancy. Of course, the next 2 weeks is when the embryo grows, and that's when it will be detected, right? So that's when the pregnancy starts. Actually, it is in the middle of the cycle, but because it is very difficult for us to determine when exactly it would have got implanted, universally it is accepted as the date. The first day of the last menstrual period is considered as the first day of pregnancy, and we continue to calculate it for 40 weeks, right? Approximately, once you do a dating scan, we add 9 months and 7 days to this particular date, and that is calculated as your expected date of delivery. Moving on to this next question, how does conception work? Right? Again, going back to the menstrual cycle. So, we all know a lot of people who are suffering from irregular cycles find it difficult to conceive because they can't really detect the ovulation. They don't really know when the egg is released. Okay. So, the conception actually works in a way that the pregnancy is formed in the middle of the cycle. Okay. And prior to that, it is very difficult to understand when you have ovulated. What happens right after conception? So, as soon as the embryo is formed, the embryo starts developing. It is a rapidly dividing structure. It starts rapidly dividing. It is forming different structures, and within a matter of even 10 days, a particular hormone called beta hcg starts getting produced, and this hormone is responsible for the urine pregnancy test, which comes positive 2 weeks later. The implantation usually takes place around 4 to 5 days after the embryo is formed. And what you need to understand is that the egg actually takes around 2 to 3 days time for it to come to the tube. So now this egg waits in the tube, and that is when the sperms swim up from the vagina into the uterus and to the tube, and they fertilize the egg and forms the zygote. This then travels slowly into the uterus and takes its time to get implanted. All in all, it takes around 4 to 5 days for this whole process to take place. It's not something which happens immediately in an hour or two. The egg is released, the sperm fertilizes it, and this becomes an embryo and gets implanted. It goes on for a course of 3 to 5 days. So how early can you know that you're pregnant? This solely depends on the amount of beta hcg in your urine or the blood. Whenever we anticipate a late implantation, right? So most of the time the urine pregnancy test may come negative. It may not always show positive, or it can show weakly positive. So you need to be a little, check it very clearly instead of completely disregarding and saying it's negative. So sometimes even a light pinkish line can come, which is weakly positive, which means it's very early. So it's probably, sometime you've got to wait until it comes like a dark red. So, if you're going to go for a blood test, for whatever reason that is, instead of a urine test, which is more accurate at determining if there is a pregnancy or not, that you can do as early as 10 to 15 days post the ovulation, or at least from when you have anticipated that you may have got the fertilization and the implantation done. So, next and the last question is, what is the timeline for the fetal development? So very easily we can divide this whole period into 3 trimesters. The first trimester ranges from the last menstrual period date, that is the first day of the last menstrual period date, to the 12 weeks. The next trimester is from the 12 weeks to the 24 weeks. And the last trimester is beyond that till term. So each trimester there is difference in what happens, what are the symptoms that you experience, what are the do's and don'ts. So it's very important to know. And we all know that most of the time we can access the information through baby chakra app, which is excellent source of information, which gives us the size of the baby, what is your baby like, what all are the structures which have developed. So it's always good to keep track of what stage you're in. And it just is very interesting to know that when there is life growing inside of you, the different stages in which that happens. So this is a commonly seen picture. I'm sure most of you have already, probably seen it. Most of the fetus development is compared to that of the size of some fruits. So the first baby is that of a small, grape. The second one is that of a cherry, the second month. The third month is that of a plum, and so on and so forth. The fruit sizes are quite interesting, but it's not always mandatory you to do it this way. Some people even just measure or see the sizes of the fetus depending on the measurements and the weight, of course. After a certain point, it's of course the growth and the development. But what needs to be understood is that the structures of the baby are formed all in the first trimester. Beyond that, it is mostly the growth. So the first trimester is so exposed to any hazardous materials or x-rays or any sort of things. The structural development of the baby gets affected. And from there, there's a lot of trouble starts. But if the first trimester, that is the first 3 months, you're careful, you don't take unnecessary medications, you don't take unnecessary foods, then once the structures are all formed, what happens beyond that is mainly the growth. So that again, then onwards, it's mostly the nutrition. What is your intake like? What is, your other parameters? Did you develop diabetes, BP? So all of those parameters come in. But the first 3 months is quite crucial for that. Moving on to just quickly understanding what is the size, the fetal developments of the babies in the first 4 weeks, right? We'll just divide the first trimester again into 3 months, the first 4, next 4, and the last 4. So in the first 4, as it is just fertilized egg, it will form a small sort of a sac, a gestational sac, and that you can actually see in the scan. It's one of the most beautiful scans that you can do for a couple who have just been trying to conceive, and then you show them the sac on the scan, and it's quite emotional for all of them. So you see the pregnancy. The first time that you see it is on the screen of the ultrasound. So during this time, the placenta also sort of develops. You also see a little bit of the covering of the amniotic sac, and certain structures which we usually detect is the gestational sac, a small yolk sac, which is kind of the part which provides nutrition to this growing embryo. And apart from this, also somewhere around the 6th week, you can see a little bit of a small tiny heart. Although we don't try to detect cardiac activity this early, the small tube of the future heart will start developing, and it can sort of be seen if you have a eye for it. So coming to the size, it'll be small. It's as small as a grain of rice, like just 1/4 of an inch. So you can just quickly just sort of see it on the screen, but mostly we focus on trying to determine how many pregnancies are there, whether it's a single or a, double pregnancy, twin pregnancy. And of course, in this trimester, in this first scan that we do, we need to determine if the sac is inside the uterus or whether it's outside, because we have to rule out if it's an ectopic pregnancy. So this first scan is quite important. In the second month, the fetus again begins to grow. And also, that in this time, the neural tube, which is very important. That's why we focus so much on the folic acid supplement, right? It's very, very important that the folic acid is taken from prior to conception and not just started after you confirm pregnancy. So this is when the neural tube starts developing. You can see other structures also. I mean, you can the other structures are also formed. You cannot really see it, but that's sort of how it goes. You can actually see the sort of a small line which you can detect is the future spine of the baby. And of course, at this point of time, you can clearly see a nice cardiac activity, which will actually be pumping the blood. You can put a Doppler on it and make the heartbeat be heard to the patient. Again, reiterating that it's a very emotional moment when they hear the heartbeat for the first time. And again, all of this information you can get when you're supposed to see what on the Baby Chakra app. The last 3 months, last 3 or 4 weeks, which is your month 3, here is where you can actually see the whole fetus. It's almost like a small gummy bear. You'll see the small limb buds. You'll see both hands and legs, and of course certain organs have also developed which you can't see in the scan. But at this point of time, it's around 4 to 5 inches, the fetus. And this is a very important time because at around 12 weeks, we have to do something called an NT-NB scan, which is the nuchal translucency in the nasal bone scan. In this scan, it is determined if the fetus is chromosomally normal or abnormal, and this scan should not be missed no matter what. It has an upper limit, so you can't do the scan anytime. You can't just go in at 14 weeks and say, okay, I'm here for my NT-NB scan, because it cannot be done beyond 13 weeks, 6 days, right? You can do it as early as 11 weeks, but that your fetal medicine specialist will determine if you're ready to go for the scan. Of course, following this, there's an important blood test called a double marker blood test, which again sort of combines itself with this NT-NB scan and determines if there's any chromosomal abnormality for the baby, which needs to be investigated further. So once you've crossed the first trimester, you know that one part of this milestone journey is done with, and you can, sort of heave a sigh of relief, because you've crossed the very crucial time that is sort of very important to get over. Because any sort of miscarriages or abortions that happen or may happen, usually happen in this trimester. Very unusual cases where we've seen the heartbeat coming and then the patient losing the baby beyond 12 weeks. Those will be completely different causes. But if there is a genetic abnormality or something which is not compatible, the most common time for any miscarriages or abortions to happen is in the first trimester. So next, moving on to this very common question that I get all the time. What are the foods that you're not supposed to take in the first trimester? This actually applies to all trimesters, so not just first, but of course first trimester. So, we always generally say, it's become like a very common mantra, no sweet, no spicy food, no oily food, no junk food. Okay. So this slide very clearly shows all sorts of junk food. You should avoid having any processed food, have more food which is just freshly plucked, which is fresh, but you have to make sure that it's very clean and hygienically purchased, not from any very dirty vegetable market. Even if you do, make sure you bring it back home, wash it with salt, and just make sure that any sort of dirt or something is definitely cleared when you're having raw foods. But as such, it's preferable to boil it and have, so that it gets rid of any sort of infection that can cause food poisoning. So a lot of people ask about coffee. You can still continue to have coffee, but just 1 cup a day, which is not containing too much of caffeine. But if you can avoid it, then nothing like it. Okay. But I'm sure a lot of you still continue to have, because 1 cup is still admissible. Don't have any raw foods, raw, like your poached eggs and eggs which need to be taken only in proper boiled state so that any sort of germs or bacteria are gotten rid of. Of course, everybody knows alcohol is completely forbidden. It can cause a lot of issues for the baby, along with smoking. So these two have to be, avoided without me even mentioning it, right? So uncooked meats, your salmon and your sushis and all that, which contains raw fish, please avoid all that. And of course, MSG, that is something that you have to avoid. Avoid having any foods on the roadsides, which will usually contain MSG. They make like fried rice and noodles on these roadsides, which contain MSG, which is just easily put in to improve the taste, but it causes a lot of the baby. So some of the other things that take that your water intake is very good. So what are the things that you should actually be doing in terms of diet first trimester? Folic acid, like I've already mentioned, very, very important to make the spine development healthy. It should be preconceptionally taken and not started only after you confirm pregnancy. The calcium, extremely important. Any source of calcium, you can have your milk, paneer, cheese. But of course, again, like I already mentioned, clean and hygienically prepared milk, which is boiled and not, unpasteurized, or which is like cold milk. And this calcium helps in the baby's growth as well as for you, because what happens is the baby is almost like a parasite inside of you, right? So if you are deficient in calcium, the baby doesn't know that, or neither does it bother. It keeps extracting calcium from you. So you will end up having bony pains, you'll end up having these joint pains, and then, fatigue, all of that starts setting in. So just make sure that your calcium supplement is very good, whether it's a natural source or it is in the form of a tablet. Start taking it as early as possible. The other thing is iron. Iron and calcium, of course, in a country like ours, we supplement it to all the women because, one in two women suffer from anemia in our country, which is a very sad fact, but, there have been programs to improve it. But a lot of iron rich foods that we already know of and which is easily available, but it's just that, we don't resort to eating it because whatever, the taste is not good. Extremely good source of iron. You can have dates, each one date every day, as long as you're not having high sugars, should help. Grapes, the black dry grapes can be soaked overnight and had. That is also a very rich source of iron. The other age old thing that I advise most of my patients to do is start using iron utensils to cook in. That's how the older generations used to get their source of iron, which was very good. And now with all of our the high five kitchens that we have, we hardly use any iron. But I think cast iron is actually making a comeback. A lot of people are purchasing it and using it. So cast iron vessels is good again to improve your source of iron. Proteins, your plant proteins, animal proteins, both are very good. Make sure you drink lots of water when you're taking proteins because they need that amount of water to get digested, and you cannot afford to be dehydrated because that can affect your kidneys. Make sure lots of water, lots of proteins, that always goes a long way. The last is vitamin D, of course. This I would say in combination with calcium. In a city like where I'm talking from in Bangalore, there's hardly any sunlight because we get up every morning to a cloudy morning. There's absolutely no sun exposure. So almost every other patient of mine is on vitamin D supplement. I don't really go to check what is the vitamin D levels because it doesn't make sense. I've hardly seen any cases of hyper vitamin D in them unless they've taken it for a really long time. So most of my patients with the calcium, they either take the vitamin D or separately, if they specifically complain that they have some sort of a back pain or some sort of a joint pain, muscle cramps, and it's very easily vitamin D deficiency. So we supplement them with that. So quickly, just to go through what are the do's and don'ts in the first trimester, just to quickly a recap. So small frequent meals really help. We all know that we suffer from nausea and vomiting in the first trimester. So make sure that you have split of your meals and not just everything at once. Like let's say you have breakfast at 9 and then till 2 o'clock you don't eat anything. That's not good. So you have split of your breakfast at 9 and the remaining half at 11. So if you're going to have 4 idlis, have 2 idlis at 9 and 2 more idlis at 11. And then at 12 you can have, this is 12 p.m. in the afternoon, you can have a little bit of a juice or some sort of a porridge. Then again 2 o'clock you're going to have your lunch. So lunch again gets split. You can have your chapati sabji and then a little bit of rice again at 4 o'clock. And then again at 6 o'clock, a small snack in the form of a fruit or a dry fruit. and then some sort of liquids, again coconut water, something at 7 o'clock, and again at 9 o'clock your dinner again can get split from 8 to 8 o'clock. So avoid having anything very heavy at one go and then not eating anything for a really long time. So small frequent meals, this helps prevent acidity, it helps prevent nausea, vomiting, and it goes a long way. All throughout pregnancy you can practice this, so that you're not suddenly hungry and you feel like gulping down a lot of food, and at the same time your baby is also receiving the right amount of nutrition that it requires. Go to bed early to reduce fatigue. This is mostly for the women who are working, because if you have long hours of shift where you're doing a work from home, avoid taking the night shift where you're up all night and then your sleep is disturbed, because that automatically leads to a lot of fatigue. And then early morning, you're sleeping the whole time. It's good to get up in the morning, go for a short walk, just sort of, gets your energy up, and you don't feel that fatigue hitting you. Avoid traveling long distances. If you still are, cannot avoid travel, you should talk to your gynecologist for some sort of uterine relaxants that they can prescribe, so that your uterus is not disturbed and doesn't go into cramps or cause sort of pain. So I have some patients who travel like 20 kilometers every day, and they're very low risk, but they have to do that for their work. So I prescribe certain medicines which keep the uterus relaxed, and they sort of feel better when they start taking those relaxants. While you're at work, make sure you don't put your laptop right on your lap. Make sure that you are not very close to the Wi-Fi modem. So some sort of hazardous things at work need to be taken care of. If you're exposed to some sort of toxins, if you're working at a factory with paint and the gas, the smell, the air is polluted, so you have to get rid of these toxins. And this is especially important in the first trimester, because if the baby is affected because of these toxic materials around you, then there's no return from there. It's affected once, it's affected forever. So make sure that your workplace is made safe once you conceive, right? And delete all sorts of toxic things in and around you. So physical activity, like I already mentioned, yoga, walking, it's very simple. You don't have to stress and wonder, what do I do, what do I not do. Walking is the most simple sort of form of exercise, the safest in pregnancy. So after every meal, actually, I insist on my patients walking, because it helps in the digestion. It helps them to get hungry for the next meal. Otherwise, if you're just sitting and eating and not doing any activity, you actually just feel bloated and just lazy the whole time. So a short walk after every meal helps a lot. You should definitely consult with your doctor before taking any sort of medication. This is very important, because when we're not pregnant, we just have a headache, we pop in a Saridon, we have like constipation, we take something else, we have some muscle pain, we take some painkiller. So that is absolutely no in pregnancy. You have to consult your gynecologist before popping any sort of pill which is not prescribed by them. A lot of patients go through dental treatment, or eye treatment and all of that. So always make sure you check with your doctor about the medications that are prescribed by some other doctor while you're pregnant. This also, I would also like to mention, the beauty things that we do when we are not pregnant is not the same that you can do when you are pregnant, especially hair coloring, hair straightening. They do involve a lot of chemicals, and there are no significant studies which show that it's harmful or harmless. Absolutely no study shows that it's completely harmless, because the contents of all these products have to be seen like individually, and it's quite impossible to do a study like that. But for those 9 months, if you don't have to color your hair or straighten your hair, I think you can just do with that. So avoid doing any sort of unnecessary things, beauty regimes in the 9 months, especially in the first trimester. Please avoid it. And as easy as it is that we can say avoid stress as much as you can, but it's just not something that all of us can do, especially with the work from home regime that has come up because of COVID. It's very important to de-stress yourself, unwind. You can read a book, go for a walk, just watch a really nice movie, feel good sort of a movie. So just inculcate few habits that you need to change the atmosphere around you. If you're just like doing your laptop work, eating, again work, eating, that really doesn't help. So do some meditation and breathing exercise. Just 5 to 10 minutes a day always helps. So other than that, I would like to say that, just one second. Right. So I'll just go back. I have the last slide here. I'll just go through the warning signs, and then I'll come back to the questions. So these are very important warning signs that everybody in who's pregnant should be aware of, and they should report to their doctor immediately if anything like this happens. The first and foremost is vaginal bleed, which is quite a scary sign, though it's very important not to panic. um, Immediately, when there's bleeding in first trimester, people think they've had an abortion, and then they just like, lose it. They're just like, oh, it's gone. But that's not true. So please report to your doctor, get a scan done, and your doctor will tell you what is happening inside. Most of the times it's a small bleed inside which would have come out, and because of that some amount of fresh red bleeding would have come. So there's a treatment for that. We give certain tablets to reduce this bleeding. If you're on anticoagulants or some sort of blood thinners, that may be the cause, so we stop that. So don't jump to any sort of conclusions, but this is something that cannot be ignored. If you have vaginal bleeding, please report to your doctor. The second one is excessive nausea, vomiting that lasts for more than 12 hours. Now, here, we know that there's a difference between emesis and hyperemesis. So, emesis, everybody has once in, 2 3 days, you have vomiting. That's very common. Okay. It has to happen. And that happens because of the hormones and the changes that your body is going through. But if you're continuously vomiting and absolutely no intake, and you're totally dehydrated and totally like, vomiting continuously for a whole day, that you cannot ignore again, and you need to report to your gynecologist for that, because then you'll need IV fluids, and of course we need to detect the level of dehydration that you have and accordingly treat you. Because if it becomes too much, then it leads to acidosis, and that is something that gets difficult to come out of, and then prolonged stay in the hospital. So better to deal with it sooner than wait thinking, okay, it'll get reduced, let's wait for some more time, and then land up in a very bad situation in the hospital. So sooner than later is better. We'll just give some IV, antiemetics and IV fluids. You'll start immediately feeling better, and then we discharge you within a matter of 12 hours. The next one is high fever. So what the problem with fever is that whatever you measure is not your core body temperature. Whatever you measure is the surface temperature, where you put the thermometer either in your armpit or even under your tongue. So imagine if on the surface you're like at 101, your core body temperature, which is inside, near the uterus, will be at least 1 or 2 degrees higher. So the fetus cannot withstand such a high temperature. That is the reason any patient with fever, we tell them to immediately report us, or at least take a dolo to reduce your temperature. Because if surface temperature itself is 100, 101, and you have a small fetus which is so delicate inside trying to grow, if it's subjected to such high temperatures, it will definitely succumb. And sometimes I have seen, especially during the COVID pandemic, we used to have a lot of patients COVID positive, high fevers. In spite of taking dolos, the heartbeats had not come, and they ended up with a missed abortion. Fever is very, very underestimated, and any sort of viral infection can lead to this fever. So any sort of fever needs to be reported to the doctor. Any vaginal discharge, again, if it's foul smelling, itchy, it can indicate a fungal infection, and if not treated, it can lead to urine infection. So make sure that you get that treated. Any calf pain or leg pain can indicate some sort of very serious complications. Most likely, it will just be calcium deficiency. But for whatever reason, if you have any of this, you need to report to your doctor rather than just dealing with it on your own. Any swelling in the head, any pain in one side of the head, because again this can indicate migraine, and if that is the case, we need to deal with that. Or sometimes it can indicate some sort of thrombosis. So these are the signs that you cannot ignore, and you have to report to your doctor. And of course, if any pre-existing condition is there which you're checking on, such as asthma and high blood pressure, which was there prior to pregnancy also. So in pregnancy, if these conditions get aggravated, you will have to report to your doctor. So that's the end of my presentation. I kept it very short because most of the information is available to you. It's just up to you to use it, and make sure that you follow whatever has been told. Yeah, so one of the questions that has come up is, should I avoid alcohol? What can I do if I had a drink 2 days before knowing I conceived? Now, obviously, nothing can be done. So what happens in pregnancy is that it's like an all or none phenomenon. Okay. When I say all or none, it's like either whatever you did in terms of taking an alcohol drink, or some medication which is teratogenic, or some sort of problem which may have caused a problem to the pregnancy, it will lead to an abortion, or it will grow into a healthy baby. So if the damage is already done, then nothing can be done about it. But in your case, it depends on the quantity that you had, which you've not mentioned. Like, I had a drink is ambiguous. So I won't be able to really say exactly what may be the implications of that, but please make sure you do avoid it. Make sure you go for your normal health checks, antenatal checks. The scans will tell us if there's been any problem. There will be definitely certain indicators which will tell us if there's any problem. But in your case, I don't think there should be any problem. So there's nothing to worry, but just please make sure that you follow the regime that's advised by a gynecologist. Go for the scans and the blood tests and make sure that from henceforth you don't have alcohol, because obviously when you had it you didn't know you were pregnant, so it should be fine. Please don't worry about it and stress out about it. How much weight should I gain in pregnancy? It's an excellent question. So most of the time what we see is the ideal weight is around 8 kgs is what is prescribed. So we say around 1 or 2 in the first trimester, but most of the time in first trimester patients end up losing weight because they're just vomiting all the time and they're just not able to eat anything, so they're just having like simple rice and curds and all that. So first trimester sort of just goes out of the window. You probably will not gain a lot of weight, but the second trimester you should be able to gain around 3 to 4 kgs at least, right? Slowly. So one every month, 1.5 kg every month should be good enough. And then the last trimester is again another 4 more kgs. So totally around 8 to 10 kgs should be the norm. Not more, but less is still okay, because as long as your baby is growing well, it's fine. I have had patients who have not put on a single kg. They will stay the same on the day they conceived and the same on the day they delivered. So but the baby was healthy, right? So what matters is the health of the baby. If the baby is also showing a stunted growth and the mother's not putting on weight, she needs to be put on certain protein supplements, certain amount of products which will help improve her nutrition status, and definitely the baby's growth will also improve. So, what prenatal vitamins should I take? That's the next question I'm taking. The prenatal vitamins we usually prescribe are folic acid. Okay. And what I would suggest is before you start taking prenatal, this prenatal, by that you mean before you conceive. So, please go down for a preconceptional counseling. So that's when your gynecologist will get a few blood tests done, understand what is your thyroid status, your glucose status, what is your blood pressure like, are you optimal, to start planning. And that's when they will prescribe all the required medications to take care of the pregnancy. So if you have any thyroid issues, so you need to be started on thyroid meds, because if you do have abnormal thyroid and you conceive, that can lead to an abortion. So make sure that you have a preconceptional counseling with a gynecologist before you plan to conceive. Both you and your partner need to go, because if your partner also has certain issues like he smokes or any other issues like that, that needs to be looked into. So please make sure go for preconceptional counseling. That's when the prenatal vitamins will be prescribed. Hemoglobin is low, we'll give you some iron. If you complain of aches and pains, we'll give you calcium. But definitely folic acid is one supplement you have to start at least 6 weeks prior to pregnancy is planned. Yeah, so I'd like to end this good session that we had. I hope that most of you got all the information you needed. Please make sure you download the Baby Chakra app, which is an excellent app, and it's India's #1 parenting app for all the aspiring women, for all the aspiring couples out there who want to conceive and who have also conceived and want to get more information on their pregnancy. With every trimester, a lot of information is available on the app which you can use and inculcate in your 9 months, because ultimately in our whole lifetime we may conceive, we will go through pregnancy like maybe once, twice, maximum thrice. So make sure you do it right with Baby Chakra. You can use my referral code Smrithi, which is SMRITHI, and you can follow me as well. So this was a great session. I hope you guys had a good time and I was able to answer all your questions. Please feel free to message further on the app. I'll be able to get back to you on there. Thank you.